Tuberculosis, also known as TB, is caused by the bacteria Mycobacterium tuberculosis that most often affects the lungs. Tuberculosis is both preventable and curable. TB is spread from person to person through the air. When people with lungs TB cough, sneeze, or spit, they propel the TB germs into the air. A person needs to inhale only a few of these germs to become infected. About a quarter of the global population is estimated to have been infected with TB bacteria, but most people will not go on to develop tuberculosis disease. And some will clear the infection. Those who are infected but not yet ill with the disease cannot transmit it. People infected with TB bacteria have a 5 to 10% lifetime risk of falling ill with tuberculosis. Those with compromised immune systems, such as people living with the HIV virus, malnutrition, or diabetes, or people who use tobacco, have a higher risk of falling ill. When a person develops active TB disease, the symptoms such as cough, fever, night sweats, or weight loss may be mild for many months. This can lead to delays in seeking care and results in transmission of the bacteria to others. People with active TB can infect 5 to 10 other people through close contact over the course of a year. Without proper treatment, 45% of HIV-negative people with TB on average, and nearly all HIV-positive people with TB will die. Today, on your favorite health TV talk show, The Physicians, we'll be discussing tuberculosis, the causes, risk factors, diagnosis, management, and of course, prevention. It's another exciting day on your favorite health TV talk show, The Physicians, where your health, of course, is our business. My name is Dr. Mimuna Yusuf Kadri, one of your favorite co-anchors on this show. And with me is...
My name is Dr. Martina Agbere. Welcome to The Physicians, where your health is our business and will always remain our business.
So today we're discussing tuberculosis.
You know why I'm even more interested? It's because now we have a surge in the number of cases of people coming down with tuberculosis.
And you'll be wondering, what are we not doing well? Why is it, becoming an issue in 2022?
Is it because of the immunization and not being vaccinated, or vaccinated and not being immunized, number one? Is it because of our environment? Are people's immune system becoming
more compromised?
Absolutely. So everyone has been saying, they've been talking about tuberculosis. Have you been immunized?
What is our take on it?
Our take on it? So today we're going to be discussing tuberculosis, the causes,
and everything that
has to do with
that's in between.
Okay.
We'll be right back after this short break. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today, like I said earlier on, we'll be discussing tuberculosis, causes, risk factors, symptoms, diagnosis, management, and prevention. And with us in the studio today is an amazing and delectable public health physician and the Secretary General of the Medical Women Association of Nigeria, Lagos State Branch. She is no other person than the amazing Dr. Omobolanle Johnson.
Thank you, Dr.
You're welcome. Welcome. Nice having you again here.
Can you just enlighten us more on what tuberculosis really is?
So it would surprise you to know that tuberculosis is not a new disease. In fact, it has said that the first case of Mycobacterium, they found it like 3 million years ago. But as tuberculosis, there's about 9,000 years ago, they found a mummy. The mummy that was present 9,000 years ago somewhere in the north of Africa, of a mother and child, and they were able to detect Mycobacterium tuberculosis. Now, there have been postulates that is even longer than that, maybe 15,000, 20,000 years ago. But they have those mummies that have the Mycobacterium tuberculosis, so it's not a new disease. Again, in the 1800s, 1/7 of Europe and America was wiped out by tuberculosis.
This same tuberculosis?
Yes. It was called consumption. It was called the wasting disease. Because what they knew then was that...
It wasn't called tuberculosis?
Yes, because it was only when a man called Robert Hooke, I'm sure you heard about Robert Hooke,
the Hooke man.
discovered, yes, that was when he now named it Mycobacterium tuberculosis, and that's when the disease became known as tuberculosis. So it's not a new disease. But how did they used to treat tuberculosis just like our native doctors used to? So many people died. They used to let blood. They used to do all kinds of funny things until the advent of antibiotics, especially streptomycin.
No, Dr. Johnson, before we even go into that treatment, stage, it's good for us to also know what causes this. Because now you have talked about wiping disease, you've talked about wasting disease, discovered among the mummies in the, of course, northern sphere of Africa. That is like Egypt and co.
Yes.
And the fact that it was named by one man, later on Robert Hooke, and said the name is tuberculosis. People will also want to know what is it that can cause this thing, so that they will be aware. And am I at risk of having this disease?
Everybody is at risk of having the disease.
So the three of us are at risk.
Well, and I'll explain how. It's different. It's in different stages. So nobody is immune from having tuberculosis. However, let me say a little about tuberculosis. So it's a bacterium, and it occurs. It likes the lungs. So, and that's how it's actually passed from one person to the other. So it's when you cough, sneeze, spit, laugh too loud, just like I have now, and you kind of send out little droplets in which these bacteria are, because they are resident in the lung, and then they hang out in the air. And for people who are in close contact, so wherever you have crowded spaces, especially for people who have low immunity, either because they are ill, extremes of life, they're smoking, they're not eating well because of poor social economic, the place is not well ventilated, you can have what we call the infection. Now, the infection does not mean you have the disease. The infection just means that you've breathed in the microbacterium, and not everybody that breathes it in will actually have that infection. You have the infection, it might just stay there latent. And 30, 40 years after, it now becomes, maybe something happens, person has HIV, person is ill from diabetes or any other immunocompromising condition, the bacterium now gets a little energy and begins to multiply. And once it starts multiplying, it now becomes the disease. Now, the disease is very important because, as we know, one person can spread to as much as 15 people in 1 year. And in 2020, up to 10 million people did get tuberculosis worldwide, especially in low and middle income countries. And Africa is number one. So Africa is number one. And if we are the most populous country in Africa, Nigeria is very high on that list. So also things like how do we live? Are we living in overcrowded conditions where there's no ventilation, where the air, it's important for air to move in and out, and the bacterium is not sitting out in droplets in the air. So there's always something called a social determinant of health. Social determinant of health means that there's this disease. Not everybody gets it because of all the social components that you and I, one person may have or not have. Maybe the person is poor, is living in a face may I slap you, where there are 200 people living in a room, struggling for water. Okay, maybe during the end SARS, where people were
We'll have
sitting
to come
together,
Yeah.
there are riots, people are
crowded
therefore in
environment.
crowded environments, people that live in residential homes, doctors are, yes, because you meet all, you expose
You see
health
patients
workers.
daily?
You see patients daily. Some of them have TB disease, not even the infection. Doctors, you have also people that prisons,
Yeah.
and the Nigerian prison is
Yeah.
very, very extremely overcrowded. So
Overcrowded.
those are places where it's very, very possible to have to have like
More like the risk
yes,
factors.
to
Yeah.
increase the risk
Yes.
of when
You
you go
having
in, you are
TB.
very more likely to have TB.
Okay. So now we talked about it during the introduction, that is a wasting disease, okay? Maybe that will take us to the symptoms. How do you identify someone who has the disease? And with that, you will also tell us the global impact of TB. What will be the global impact of TB? Well, we can start with that. Then you tell us the symptoms. How do I recognize someone who has TB?
Now, the global impact of TB, I've already said that every year, 10 million people, that in 2020, 10 million people had TB. That means that if all those people were not properly treated,
Perfect.
in that
Yeah.
year, you could have 10 million could have become 150 million people.
Yeah, because one person can infect 15 other
5
people.
to 15 other people in one
Yeah.
year. So look at the resources that will be spent, and then look at the opportunity cost of those people. If the person is a breadwinner, he's not able to work, he's coughing, he's not able to walk, he's coughing, his family cannot be fed. We now have cases where people go into poverty
Because of that.
because of illnesses. So in places where TB is, we don't have like a basic medical care, or where you don't have health insurance, or where governments or NGOs are not, we're lucky in Nigeria. Most people don't know it, but there's free care for TB.
What did there, Dr. Johnson? Free care for TB,
Yes.
because, we are living in an environment where everybody's saying healthcare is not affordable, it's not accessible, it's not available, and in fact, what we even have on ground is not acceptable by us.
Because we're trying to eliminate tuberculosis globally. In many countries across the world, especially in Nigeria, right across Nigeria, primary health care centers are offering free treatment for tuberculosis. In Lagos, for instance, they're actually going around with X-ray machines, picking people off the street and asking, would you like to do an X-ray? If you have a cough, even for a week, they will do a free X-ray for you. And they're also doing free sputum tests. Another thing they're doing is they're tracking. If there's somebody in a family or in a neighborhood that has TB, all the people around that person are...
It's like contact tracing.
Yes, contact tracing for TB. So they all come in and they have sputum tests or chest X-rays. For children, they might have to have stool tests. Because children, of course, when they cough, they swallow. And so a lot of the time, children have TB abdomen. So tuberculosis is more difficult to diagnose in children. And therefore, there's presently now a drive to ensure that all children with TB, first of all, that prevention of TB is done with the vaccine, the BCG vaccine, and then all children with TB that can have TB are traced, the tests are done, and they are treated immediately. And in most primary health centers in Lagos, the drugs are given free, 6 months free. So you come in and then they give you the drugs initially 2 weeks. Often they ask you to come with somebody because it's something called a directly observed treatment. You want to be sure that that person is taking the drug. So sometimes you ask a family member to come as a consult, or if the person doesn't have a family member, it might be the health worker that will now ensure that those drugs are taken regularly. Because believe you me, if those drugs are taken regularly for as short as 2 weeks, most of the time the tuberculosis goes in decline. But you need to take it for 6 months to ensure that there isn't a resurgence. So that is it for tuberculosis. So prevention.
Before we go on to prevention, you want to talk about the signs and symptoms
Okay, so
now?
let's talk about the signs and symptoms. First of all, they're the general signs. So fever. So when people come to the hospital and they say, I have malaria, please, every fever is not malaria, and every fever is not a typhoid fever. If you feel that your body is hot, please just tell your physician, your doctor, I have a fever, or I have a high temperature, or my body is hot. Then we talked about a wasting disease, weight loss, night sweats. Those are the general symptoms. Then, of course, there are now the symptoms that have to do with where exactly the tuberculosis chooses to live in.
Okay.
Normally, we'll go to the lungs, but tuberculosis can spread to the entire body. So if it is in the lungs, people come with cough, with breathlessness, with they cough up blood.
Okay.
With cough of blood, difficulty in breathing and all that. But it can occur anywhere. People have TB meningitis where they go unconscious. They have TB spine where people have like an S-shaped spine because the bones of the spine, they're brittle and they just bend. You have TB abdomen where sometimes there's an obstruction, TB of the liver, TB of the kidneys,
Anywhere
of the joints, of any part of, yes, so it can, through the blood, it can go anywhere, and whatever symptoms you have will depend on where exactly the focus of the TB is, and you can have in more than one place at a time because it now moves through the blood to all parts of the body. There's even TB uterus.
Wow.
Okay.
So every fever, so for like menopausal women, I
think you need to emphasize on that because menopausal women, a lot of them complain about sweat and night sweat. And night sweat also is also a symptom in tuberculosis, and they will just assume it is menopause.
Yes, and particularly for people who live on the rich end of town. A lot of people, because they live on the rich end of town, believe that they cannot have tuberculosis. I have a story of a very wealthy young woman who left Nigeria. They looked for everything, and finally they found that it was tuberculosis. So when you're having night sweats, a cough, so now any slight cough, night sweats, once you do like a blood test, and there's even now a blood test that will tell you if you have been in contact with tuberculosis. And then there's also the skin test that Dr. Roberts was talking about in the previous episode. So the skin test tells you you have been in contact with tuberculosis. It doesn't tell you that you have it.
Okay.
However, there's a bit of a problem. For people who are immunocompromised, they might not be able to raise enough response for the skin test. So people with HIV may not give you the right response. But for other people, we call it a tuberculin test. It just tells you that, oh, this person has been in contact, whether as the BCG or as proper tuberculosis. Of course, the chest X-ray is now a screening test, especially if the person is coughing, has been in contact, and then there's sputum. And then for children, as I said, we can also take the stool. There are many other tests that can be done, but those are the ones that are readily available, very simple to get, and very simple to get through in this environment.
Okay. So we already talked about the diagnosis, okay? And you're going to go into the prevention. Before you get to the prevention, do you want to tell me the correlation between the TB and HIV? I'm sure you will say because of the immunocompromised
Yes,
state.
it is because of the immunocompromised. So HIV, somebody has, in fact, we call them brothers. Once somebody has HIV, you have to make sure the person does not have TB. And if somebody has TB, you must do an HIV screening test because the person is immunocompromised. Now, the problem is there was suddenly a spike in TB, especially in developed countries. And in those places where the social determinants of health have been dealt with, there's free airflow, people are not overcrowded, they suddenly started seeing more people with TB. And they found that a lot of this was found in people who were HIV positive because they cannot raise the immune response. So for people who are infected, they cannot stop themselves from being infected, and those who were infected previously were going on to have the disease in much higher rates than the 5 to 10% that was expected in the general population. So that is what was happening. So if there's an upsurge in HIV, there will be an upsurge in TB, just like with other cases where a person is immunocompromised, either from even things like drugs. So if you have somebody is immunocompromised because he's taking prednisolone, cancer treatment, all these people are also at risk because of the fact that they're immunocompromised. They are more likely to have TB, and you must have a high index of suspicion for anybody who, for any reason, is immunocompromised, even at the extremes of like babies and so
elderly. So, Dr. Jones, this question is has been kicking, and we tend to have viewers, from the previous episode, and this question came from one of them. I was like, look, okay, now you're talking about tuberculosis. Somebody who has it can infect 5 to 15 other persons that they're in contact with. So if one person in my house has it, what happens to us? Should we leave the house? What do we need to do in ensuring that the people in the house will support the one who has it, and also make sure that they are prevented? And what are the likely complications of tuberculosis?
Okay, so first of all, the health system now needs to ensure that everybody around that person is traced. If the health system has not done its work, please put yourself forward and ask to be screened for tuberculosis. For people who are HIV positive, if, for instance, in that family, somebody is HIV positive, apart from the general things we have talked about, ensuring you are eating well, because food and nutrition, you won't believe it, is also very important. Ensure that, the windows are open, try and live in a place where it's not overcrowded. There are drugs that are given to contacts of, yes, so there are actually drugs to prevent. These drugs are given particularly for people who are HIV positive because they are or anybody who is immunocompromised, and for children less than 5 years old, they are given the it's
pregnant women also can have
pregnant women. Yes.
With pregnant women, there's also, you always want to look at the risk.
The risk. Pros and the cons.
Okay. So if the person is, you just do it like a follow-up. They do the chest x-ray and follow up the person closely. If the doctor might now decide to give that pregnant woman the drug. But the important thing is that all these people are screened. But children less than 5 years are usually given the drug, and anybody that is immunocompromised are given the drugs. So tuberculosis is a disease, is a very real disease, it's an old disease, and it's a disease that can have a lot of effect on your life. The complications are real, they're enormous. It can affect the whole family. You have the physical complications, the person is ill, very ill for months, loses weight. Social complications, people begin to run away from you. Because stigma from TB. Family members are unhappy because they believe you brought it. Everybody has to go through the health system. Financial complications. Even if you are not paying, somebody is not going to work. You are having to leave your work every day. You are going to the hospital. There's a cost of transportation. There's the opportunity cost. Somebody is supervising. The opportunity cost of not doing something else while you are being treated. And then, of course, there's the financial complications itself for people, because you might have to buy vitamins, you might have to eat better, you might have to change where you live. All those are the complications of tuberculosis.
We said one thing about the tuberculosis resistance, something to just for our audience.
So it's very important for tuberculosis to be diagnosed early and treated early. And please, even though the drugs are free, you must complete your drugs for the assigned period. It can be 6 months or 9 months. That is what usually leads to resistance. And once you have a resistant strain, other people can get that strain from one person yes. So even though you've taken your drugs properly, if you got a resistant strain from the first person, you have that resistant strain. There's multi-drug resistance, and there's the resistant strain that you can't even find a drug, XDR, it's called XDR, extreme drug resistance TB.
Dr. Johnson,
we say this is our portion.
and we don't have to wait to that stage where we say it's not our portion. It's obvious we definitely have to bring you back for us to be more aware of this strain that doesn't really have much options with regards to treatment, so that people can be more sensitive when there's an issue. Don't cast it away, don't bind, and don't tell yourself it is not my portion, but do the needful. Medication is free, but complete your treatment. Dr.
Yes.
Johnson, once again, thank you so much for coming on board. It was so refreshing talking about this very important topic, and of course, with the surge that we are seeing, it's good for people to be aware. Viewers out there, you've heard it all. The good news is that tuberculosis can be prevented, and it is treatable and curable. But it's for you to ensure you do the needful. Please, the signs and symptoms that we've talked about on this program today, of course, not all fevers are malaria. Not all fevers are typhoid fever. It could be tuberculosis. If you have night sweat, it may not necessarily mean that it's a sign of menopause. You can't know. Just make sure that you do screen and get treated as soon as possible. The thing is that globally, tuberculosis is needed to be eradicated, so treatment for it is free. But it's your duty, because it may not be your fault that you have tuberculosis. It may be somebody around you that might have, caused it. Because for one person who is infected, that person can infect 5 to 15 other persons, and annually, about 10 million people are infected. But it is your responsibility to ensure that this treatment that is free, you take it at least 6 to 9 months and get tuberculosis out of your system. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
So I join my co-anchor in saying thank you, Dr. Johnson, for coming on our program, and we hope we'll see you again soon. And for our viewers out there, I'm sure you had a very wonderful time listening to Dr. Johnson. Remember to follow us on our social media platform, YouTube, Instagram, Facebook. And if you want to be part of this program, you're just a click away. Go to the website, which is up and running, and send us an email. My name is Dr. Martina Agberie. Stay blessed.